So, how does acupuncture work? Another great question I get all the time. There's a lot of different theories, and I think they're all a little true or really true. It just depends on the perspective, the patient, and the condition that we're working on. So, I'll go over a few of the theories that I think have a lot of credibility behind them as far as how acupuncture works. I've been practicing since 2013 professionally, so I have quite a bit of experience here, and I've seen a lot of different cases. And so, my favorite theory is the bioelectricity theory, or chi, which would be another term for bioelectricity. It's the electric circulation that your body kind of runs on. So your heart beating, muscles working, nerve conduction, all of this is done through um, ions moving from one side to the other, which is more or less electricity or bioelectricity. And every living thing has bioelectricity in it. And acupuncture manipulates that chi or bioelectricity. Acupuncture points are parts on the body that have an increase in blood vessels and nerve endings in that area. And when we stimulate that area with a metal needle, think of it like a little antenna, we're really increasing the circulation of the chi. And the text tells us that all pain and discomfort and disease is caused by a problem of chi circulation. So if we can correct and benefit the chi circulation, we can help the body heal and help the tissues respond correctly and alleviate pain and discomfort. So that's one of the theories. We have the bioelectricity theory. We also have the microtrauma theory. And so we're thinking about the perspective of the acupuncture needle kind of coming into the skin and going into the connective tissue, and it's, poking a little hole. That would be considered microtrauma. And sometimes when we create these small controlled injuries, it stimulates the immune system and healing functions of the body to respond and then address whatever condition may be out of balance for you. So it helps with cellular regeneration, reduces pain and swelling, and can relieve muscle tension to improve healing. Another theory number 3, is the neurochemical theory. And this theory, I think, explains why acupuncture gets you this like high, floaty, buzzy, happy kind of feeling, because it stimulates the release of endorphins, dopamine, and serotonin from the brain into the cells and into the tissues, which promotes great sensations of well-being and relaxation, calms the nervous system, and in regulating the central nervous system, we can benefit the rest of the tissues of the body. So we have chi or bioelectricity, we have microtrauma, we have neurochemical theory, we also have the fascial theory, fascia. So fascia is a layer of tissue below the skin and above the muscle. It surrounds all of our organs, it creates our tendons and ligaments. It's kind of the sac that holds everything in place where it should be. And the fascia can get tight and dry and wound and knotted up. And so this is something that you see with like muscle knots. And this is something that we see with like post-injury, like adhesions, when you can't lift your shoulder up like you should, or you can't bend your back like you should, or your neck doesn't turn as it should. Oftentimes the fascia can be involved. And the acupuncture pins stimulate the fascia by stretching the tissue, stimulating blood flow, and releasing trapped tension. And that alleviates pain and discomfort. So this could be a theory that explains kind of how it works for musculoskeletal pain and knots and things like that. Helping with range of motion and that stuck feeling that can happen in the body. And then my 5th favorite theory is the gate control theory, which basically talks about closing the gate. So sometimes, like, you could think of it also as like the switch theory. So like sometimes the switch gets stuck on for things like the adrenal system, like the fight, flight, and freeze. Like sometimes that switch can get stuck on, or pain signals. Sometimes chronic pain is just a loop where the nerves just keep sending these signals, round and round and round, but it's not actually doing anything meaningful. And acupuncture can shut the switch off or close the gate that stops these chronic pain loops from continuing on. And that can be very helpful for patients who have like fibromyalgia, MS pain, arthritis pain, post-surgical pain. Sometimes we get in these like pain loops, and acupuncture can be very helpful for stopping them. So there's a variety of different theories that kind of explain how acupuncture works, and I think it very much um, creates clarity on like how acupuncture treats so many different things. So we can think of the fascial theory for like musculoskeletal pain and the bioelectricity theory for musculoskeletal pain and micro trauma, but the neurochemical theory can really explain how we have such great benefits for like insomnia and mental health. And the gate control theory or the switch theory really explains how we can really move people that are stuck in a certain pattern and having a hard time getting out of it into another quality of life. But again, these treatments take, it's more than one appointment in order to get these, switches turned off and the fascia worked out, because there's layers and levels going on. And so it's important to just really work with a practitioner that you trust and plan to go to a few visits to really see the maximum benefit from the investment in your time and in your care. And if you have any questions about it, definitely call our office and let us know. We're happy to help you with anything you need.